Hi, welcome to DocRoach Australia. My name is Aaron's and I'm one of the doctors here. So today we're going to look at the face-to-face clinical exam. So this is the other type of the AMC clinical examination. So this exam have other common names. Some people call it the in-person exam. Others may call it the NTC or the National Test Center examination. So if you are watching this tutorial, it is most likely that you are here because you want to learn more about the face-to-face exam, or perhaps you're trying to decide between the online and the face-to-face exam to see which works the best for you. So whatever is it, let me assure you that this tutorial is going to give you all that information. You can imagine this tutorial is like a Google map. You're going to have everything from the beginning to the end very, very clearly. All right, so if you're ready, let's dive on to the screen and let me share with you what we're going to discuss. So let me bring up my laser pointer. So as you can see here, we're going to go through the sources where I got that information from so that you know that this information is legit and it's up to date as for now. And I will give you some disclaimers that you need to keep in mind. Then we're going to look about the NTC in terms of, its history, location. I'm going to give you general information about the exam, some quick tips. Then we go ahead and look at the exam day schedule and the duration of your exam, what dress codes you need to wear. And then we're going to look at the events all happening before you start your examination. So that is the check-in to the towards the exam hall. And then the prohibited items, what you cannot bring, what special requirements, and when you should tell the AMC about those requirements, candidate briefing video, technical aspects, number of stations, rotations through all the station, the background monitoring processes. So as you can see, there's a lot that we're going to talk about. And not only that, we're going to move on to the events during the assessment time. That means the reading and the assessment of the clinical examination. So I'm going to give you everything you need to know about what happens during the reading time, and including my tips. Similarly with the assessment time and my tips and the rest station. And then towards the end, we're going to talk about what happens once the exam have ended. And then I will give you an idea when you expect to have your clinical examination results. So this is going to be very exciting. So let's begin. Okay, guys, let's start off with the sources. So I got this from my own experience. I'm the author of this presentation. And I also got it from my friends who are the face-to-face exam candidates who have sat for the exam recently. And most of the information that I've got is from AMC's official website. If you go to the link whereby it's amc.org.au/assessment/clinical examination, you can get a lot of information there. But I've just took all of that and put it into this tutorial video today. The next source is, I'm going to share where I got the images from. This is all the sources where the images on this tutorial video comes from. And I heavily also use the AMC clinical exam specification PDF that is released by the AMC, so that you know that this information are true to what AMC wants to, dissipate to all their clinical candidates. This version is from the July 2021, but if there is any newer versions, I will make sure to put that in the link below. So guys, just heads up disclaimer over here. This tutorial video completely represents that of mine and that of DocRoach Australia. It does not represent any other organization. Okay, so just keep that in mind. But let me assure you that I did all the check and necessary steps to make sure that I deliver the best information for you, because I really want you guys, especially you, to pass your exam. So let's move on. So the first thing I'm going to give you is the general information. So the first thing, if you are trying to book the exam, you will know that they have two types of session, the morning and the afternoon. So you got to decide which one you want. And then if you have your exam date, when you arrive at the exam, you must arrive exactly at the time specified for your exam. And the next thing is that if you need those information, you will usually get the clear or the concise or the final version of the exam detail on your AMC clinical exam placement letter. I will go ahead and show you the placement letter shortly. So guys, the other things that happening is COVID changes. So What I understand is a friend of mine recently told that AMC is requesting for candidates to have a red test that is about 1 to 2 days before their exam. But look, it might not be forever, so always check with the AMC's current guideline whether this is required or not. The next thing, you guys may be given a N95 respirator during the exam. So this year, 2023, so far, my friends who have done the examination, they all have been wearing the N95 mask, which you can see over here on the top right of the screen. So this mask is very uncomfortable. Okay, so just keep in mind you may need to wear that. And the other thing AMC wants you to do because of COVID, to bring your own stethoscope. So let me give you some good practice tip here. So the first thing about the N95 is that it is very uncomfortable. Okay, you need to put in effort to speak clearly and louder during your clinical examination. And for those of you who have no idea what it feels like to wear an N95 and do role plays, you should at least do it one time before your actual exam. So you know exactly how to adjust the mask and how to try to achieve the outcome that you are aiming for. Okay. So this is definitely a certified advice. So the next thing is about your own stethoscope. So in the clinical specification document, AMC states to bring your own stethoscope. You can also bring your tendon hammer if you want, but it is provided though. So let me talk a bit about the stethoscope. What you got to bring is this stethoscope, the one on the left of the screen. Okay, here. This is a very basic stethoscope. It has just a diaphragm and the bell. So you need this. You can't bring the augmented or the electronic type of stethoscope. So this, guys, is the AMC placement letter. Okay, this is the letter that I was trying to tell you earlier. So if you look down here, this is where you get the exam information. All right, you can get your date, your time. Then you see the venue is Melbourne NTC and gives you the address here itself, Argus Centre, level 14. All right. So this is a very good document. You got to make sure that you have this and you're getting your information based on this. All right. So I'm going to help you with a tip on moving forward with the placement letter. So one good advice that I want you guys to do is that you got to plan your travel journey extremely well, because if you look at the placement letter, it says here, candidates arriving after 8:30 will be excluded from undertaking the exam. That is a nightmare. You already pay so much for the exam, and if you're getting excluded, there probably is no refund. So just travel, plan your travel really, really well, and arrive 30 minutes earlier. Okay, because that is absolutely stress-free. You're already having stress for the exam, and what you need is little less stress, to arrive a bit earlier. Okay, so let's move on. Oh, definitely. This is a certified advice. I mean, you will know this. So, guys, let's move on to the National Test Centre. What I'm going to talk about here is a brief overview, because now you need to know where you need to go. All right, so that's where we're going to start, and I'm going to share with you exactly, all the tips and tricks that you can use to make sure your travel journey a lot more easier and efficient. So this is the AMC National Test Centre, and this test centre is the building at the back here where I'm pointing with my the pointer. So the address is also available in Google, and if you look at the hours here in Google, it's 9 to 5, but it's not the correct one. So always remember to use your AMC placement letter, okay, to see when is your reporting time. So regarding the NTC, we're going to talk about the building. We're going to talk about the public transport, cheap car parks. When you arrive 30 minutes earlier, what do you do? Okay, so let's move on to that. So this is the brief history of the building. It's built in 1991. This is how the building looked like. If you have not seen it for the first time, this is how it is. So moving on, some brief history. This history is, the reason why I thought of putting it inside is just to give you an insight of how well the clinical examination test center is, so that if you are prepared for that, then your preparation will be slightly higher than what you're going to, initially intend to do. So the NTC is designed by a company called DJAS. All right, this is a professional architecturing company. They have designed the building specifically for clinical examination. If you look at the 3 photographs at the bottom here, this is how the examination hall looks like. This is the hall. This is the background monitoring or observation room. It's very, very prepared for clinical examination. So just keep that in mind. This is really like one of the very legit examinations, clinical OSCE examinations that you're probably going to do. And this center was completed in 2013. And this was a very interesting fact that I found. You know, when I was trying to see reviews, what I really noticed is that most of the reviews are either 5-star or 1-star. It's surprising that there's nothing in between. It's either you have a really good experience or extremely poor experience. So if you prepare really well, I probably assume that you will give 5-star to AMC. But anyway, this just jokes aside, guys. All right, let's talk about the public transport to the NTC. So the first one I want to give you is the Melbourne Central Railway Station, the metro, because I think this is quite near and it's very convenient if you're not driving to your exam. Okay, so this is one option to consider. You can use the PTV app. Okay, this is the logo over here, or Google Maps. Both give you a pretty good direction on how you arrive at the Argos Centre. The next one is tram. The closest tram stops I could find is the 5th Elizabeth Street or the Queen Street, Latrobe Street stops. So they are very close to the exam centre. So you can consider that if you want to take a tram. There are some bus stops as well. These are the addresses that you can stop at, or just put in your destination in these 2 softwares or 2 apps and you get there. If you're not planning to use the public transport, this is other options. You can use Uber, Didi or Ola. So you can consider that as well. So for those of you who are driving, this is something that is probably going to be useful for you. So you can check out Wilson's Parking. If you look at this on the screen here, Wilson's Parking is here and the exam center is directly opposite. It's like literally crossing the road. So if you want to go here for your exam day when you're driving, just put in Wilson's Parking and just make sure it's 300 Latrobe Street. Okay. And the other tip that my friend gave me was book online early for cheaper rates. So consider that if you're driving. So if you're arriving 30 minutes early, I'm going to give you a little bit of a treat here. So I want to show you that you can use some exam, you can relax a little bit. There's a lounge at the ground floor. So this is how the lounge look like. So you can sit up here and try to soak up the exam vibe. Try not to be too stressed, release that. And let's move on. I'm going to show you some other things. So if you guys are early, you can also probably get a cup of coffee. And now let's move on to the exam day schedule. So what I'm going to talk about right here is like what happens during the exam, all right, the whole period. So this is the schedule, and this schedule, you can find it in the placement letter. So the total exam duration is 5 hours. If you report in at 8 and then you end around 1, if this is your morning session. In the afternoon, it starts at a different time. Look at your placement letter again. But generally, the face-to-face exam takes about 5 hours from start to end. All right. In terms of the exam duration per se, that means how much of time that you'll be performing in the exam is about 3.5 hours on the schedule. But AMC says that these are approximate timings. If you look at where my pointer is pointing at, sometimes you may expect a delay. There might be some form of delay, but just keep that in mind. It's not something that you need to be concerned about. You have to just do your best during the clinical examination station. All right, that's all I want you to focus on. But this is just a heads up that the exam is about 3.5 hours. So let's move on. This is a timeline. It's a diagram. I want you to get a visual idea of what's happening. The moment you enter from here, start all the way to the end. When you're going to leave the exam, it's 5 hours. Okay. In the sort of middle, and this part is going to be your exam time, the actual time where you perform the exam, and that is the 3.5 hours. Okay. So for those of you who are now thinking about, to compare with the online exam, this is a very good diagram. So if you can see here, the online exam is a lot more longer. It's 8 hours from start to end compared to the face-to-face AMC clinical examination, which is 5 hours. If you guys are thinking that the 5 hours is long, check out the online. It's 8. Wow. But I did the online exam. It's not so bad. You have a lot of break in between, so it's not too bad. It seems over here. So now I want to move on to giving you some good practice certified tips. I think you need to make sure that you eat your breakfast or your lunch, depending on which session you are taking the exam. Make sure you have something not too heavy, but something nice, something comfortable for 5 hours or for 8 hours, depending on whichever exam. But we are talking about the face-to-face exam. So make sure you eat something that could, last for about 5 hours for you. And have enough rest a day before your exam, okay? Because you need to give your best during that, that 3.5 hours. So you don't want to be tired at that time. So let's talk about the dress code at this stage. So AMC recommends professional attire. All right. So you can wear anything which fits in this category. You don't have to really wear a suit, but some people do find that, appealing for them. So they do wear that. But if you don't wear a suit, it's fine, as long as it's professional attire. The other advice I want to give you is you got to wear something comfortable for physical examination. So just, to get the best idea, my advice is for you to practice at least once with the clothes that you're wearing, the clothes that you're going to wear for your exam. Just try that and do one role play and get an idea whether you can move and, be flexible and comfortable. The other thing is you got to wear something that brings out the confidence in you. So confidence is key. All right. So try to look for that kind of professional attire that you can feel confident in. So guys, let's move on to the next topic. So we're now going to talk about all the events that happen before the exam. So if you look at my pointer, I'm going to talk about everything from the time you arrive at the NTC all the way to the beginning of the exam. So this is going to be some very valuable information to help you in your preparation journey. So the first thing that you do is when you arrive, you're going to have to report in. So the first thing that your first contact with AMC is always the check-in or the reporting in. Okay, that's when the AMC staffs comes forward and introduces themselves and then ask for you guys to report in. The next thing is you'll be taken, a photograph of you will be taken by the AMC. The next thing is that you guys will go up the lift, like in this diagram here, 5 at a time. Okay, you guys are going to level 14. Okay, that's where the AMC exam center is. So let's move on to the next thing. So at this point, I want to talk about the special requirements. So AMC in their clinical exam specification, if you look here, there are some things that I've highlighted here. It says that if you have any medication requirement or food intake, due to a medical condition, you got to inform the AMC staff early so they can assist you with those requirements during the exam time. Okay, so the best for you to do is to report that during the check-in time, all right, as early as possible. So now guys, let's move on. I'm going to talk about signing in the agreement form. So the moment you arrive at level 14, you will encounter a scenario just like what you're seeing in this image, whereby you need to sign an agreement form. This agreement form is to tell that, that you want, AMC is going to record your video and audio throughout the exam and getting your permission to do that, as part of the criteria for the examination, all right, among other things. So this is going to happen. So just keep that in mind. And the next step that happens after that signing is that you will be given a tag. All right. So just like how this gentleman here is having a tag, this is the tag. So at one part of the tag, you will see your starting station. So when you look at it, you know where you're going to start. All right. And when you flip over your tag, you will see your photograph, which is printed, and you will also have your ID number. So at this point, guys, I just want to make sure that you know that you got to make sure that the tag you have has the correct ID. It's not someone else's ID. All right, just be very careful. Just double check that, and if any problems, please inform the AMC staff. So let's move on, guys. Let's talk about the prohibited material. At this point, AMCs have things that you can't bring into the exam hall, right? So it says here you can't bring any books, they call it the bureaus, the pens, the papers, your jewelries, your tie pin, your phone, any sort of times, like watch, anything, stopwatch, digital or analog watch, any kind of watch is not allowed in the exam, and you can't bring your bags, right? Your handbags. So what you got to do is you got to switch off your phone or any other digital devices, and then place all of your belongings other than what you can bring into the exam hall into your locker. All right. So that is when you're gonna have. If you look at your starting station number, that number corresponds with the locker number. So if you're, for example, starting at station number 1, then you will have locker number 1 as yours. Okay, so then you got to put all your stuff in that locker. So just keep that in mind. I hope this is helpful. So let's move on. After putting your things in the locker, AMC will keep you in the waiting room for a couple of minutes. Some of the AMC face-to-face candidate told me that it usually goes to about 15 to 30 minutes. However, if you're taking the afternoon or the PM session, there is slightly more tendency for waiting longer in the waiting room. The reason being is because sometimes the morning session can be delayed. If that delay carries on, then the afternoon session is obviously going to be delayed, and you guys are going to have to wait in the waiting room a little longer than 30 minutes. So just keep that in mind. These things can happen. Don't be frustrated. Stay focused. Your job is to pass the AMC exam. Nothing more than that. All right. So let's move on to the next point. So the next point here is we're going to talk about what happens after the waiting room. Okay. After that, you'll be brought into a room. This room. Okay. This room is where you're going to be seated, and you're going to be shown a video, a candidate briefing video. This video contains the information of how the clinical examination goes about. All right. So you'll have that going on for a few minutes. Finishing that video, the exam marshal, the person who wears a vest, the vest, like in this image, it looks like purplish, bluish color. So that vest, whoever wears that vest is going to guide you out of this hall. But before that, you can also take a toilet break, okay, before you get into the exam hall. So once this is done, then now you're going to go into the exam hall. So let's go ahead and look at how that looks like. So this, guys, this is the exam hall. So this is an image where everybody is standing at their starting position. Okay, just before the first audio or the bell sound begins, this is the image of it. Okay, everybody will be standing in front of their respective stations according to their tag, right, that was given earlier. So now let's move on. I'm going to share with you the rules and the concepts that are going to happen just before the exam. So I want you to keep in mind. So once you have those rules, what is going to happen is you're going to be a lot more confident, a lot more prepared. It's almost like a deja vu moment for you now, because you're going to see everything now, and then that moment is going to happen for you during your actual exam and save you a lot of stress. So let's talk about the first technical aspect, which is the exam rule from your point of view. So let me take out this person here, all right? So we're going to look at what are the important landmarks that you need to keep in mind, all right? The first thing is the monitor in front of you. So this monitor has questions, okay? This is where AMC shows you the STEM and the task, okay? They show you the questions that you're going to be working on during your exam station. The next thing is they want you to keep your eyes on this monitor at all time, all right? I'm going to show you more about this in detail shortly. The next thing that I want you to keep in mind is the door. If you look at the door, it contains the station number. So this is where you know that this is what the station number is. And look at this image here. See this lady, she's standing on this floor mark. So AMC wants you to stand within this marked floor mark. All right, you got to stand here all the time. Okay, only when you are allowed to go into the exam station, that's when you leave that. Okay, so just keep that in mind. I'm gonna show you this again. So if you don't do that rules, what is going to happen is the exam marshal here, he's going to correct you. He's going to say like, doctor, please do, either look into the monitor or either stand in the floor mat, the floor mark, right? So this exam marshal will correct you if you don't follow the rules. So just keep that in mind. If you're someone who's very sensitive and you don't want that happening to you, so, try your best to keep that in mind. if the marshal corrects you, it doesn't matter. It's their duty. Don't be upset with them. They are doing a wonderfully good job to make sure that the exam standards are maintained. So guys, let's look into the rules in detail. So this here on the image on the right is what you are expected to do. Okay, so you see the green tick here, which is correct. So basically this person is standing on the floor mat and looking at the monitor. So this is what AMC wants. You can't look anywhere else. So let me just make that a lot more clearer to you what I mean. So for example, if you're looking away from the monitor, this is wrong. Likewise, if you're standing out of the mat, this is also wrong. You can't do this. And the next thing is, if you are standing correctly and facing the monitor, but however you turn your head to the left, to the right or backwards, that is also wrong. Your eyes really gotta look at the monitor, okay? I'm not sure what happens if you look up the ceiling. Maybe they don't say much, but don't do all those things. Just focus on the monitor, all right? Next thing, let's talk about what happens if you don't. If you don't do those things, remember this guy. He's going to come out from nowhere. He'll come out from nowhere and say like, please correct, please do the correct thing. So just keep that in mind. So guys, let's move on to the next technical aspect that I'm going to share with you. So now I want to show you how does the exam go from your point of view. So really what I'm going to talk to you about is the few details on the clinical exam station. I'm going to share with you how the rotation occurred during the clinical exam and what is an idea, just give you some idea of the background monitoring, okay, so that you will know what is really going on. So let's start with the exam station. So as you know, AMC has 20 exam stations, out of which 16 is your actual exam station. There's total 20 stations. 16 is the one that you're going to perform something. You're going to do some assessment on that. So out of the 16, 14 of those stations are scored, meaning your pass or fail is going to be based on that 14 scored station. 2 out of the 16 is going to be pilot. And let me tell you at this point that pilot stations are not going to be obvious to you. It's going to be randomly placed in any of the exam station. So my tip here and my sincere advice to you is try not to figure out whether this is pilot or not pilot, and try not to assume that that is pilot if you're not doing well. So you got to do your best regardless, okay? If you feel you're not doing well, try to change your thoughts in the split second of that exam time and do your best. Try to score. Every point, it's important for you to pass. Just pass your exam, get it done with and move on. The next thing I want to talk to you about is the rest station. The rest station, there's 4 rest stations. This is standard in the face-to-face and the online exam. So to pass, this is the number that you're looking for. The number is 10. You got to pass 10 station out of the 14 scored station. And then you get an overall pass. And then you'll be as happy as this person on the diagram here. Right? Try to avoid being on this group. Try to avoid being in that failure group. Okay? So prepare really well. Alright guys, at this point, let's continue with the candidate rotation. So what I'm going to try to answer here is how candidate rotate throughout all the exam station. So guys, keep this diagram over here where I'm pointing with my pointer. Just have a clear image of this diagram. I'm going to simplify it further to give you a very, very clear idea of how the exam happens. So I'm going to take this person in candidate in station number 1, simplifying this image into an illustration. And I'm going to continue simplifying that into this. So I'm going to request that you guys imagine this as the station and with the person. All right. So for example, this is station number 1. So now let me give you the introduction to how the diagram looks like. So guys, this is how the AMC clinical examination face-to-face exam diagram or the map of all the stations and what is happening at that time. So let's go through it one by one. There are 20 stations as you can see here, okay, from 1 to 20. And the rest stations, I've made it green over here. So if you look at this diagram, the rest stations are number 3, station number 8, station number 13, and station number 18. These are the 4 rest stations. Everything else is the exam station. Okay, so This makes up the 20 exam station, 4 rest stations, and 16 remaining exam stations. So there are 16 stations that you are actively going to perform something in that station, and that will be assessed, scored for your clinical examination performance. So let's move on. So next I'm going to show you the rotation. So basically how the rotation happens is it's in the clockwise position. If you look at this diagram here, so it's a clockwise rotation. So from number 1 you move to number 2. If you are starting at number 15, for example, you move to 16, and so on and so forth. Okay, so just keep that in mind. Don't get confused. The numbers are always ascending. All right, unless you're starting from a higher number, right? Like 20 going to number 1. Okay, so let's move on to the next thing. I'm going to talk a little bit about the background monitoring that happens during the clinical examination time. So AMC is actively monitoring every second of your exam. All right, so if you look at this diagram, they are looking at it, they are constantly in check with the timing to make sure everything is going on smoothly, and that all happens in the observation room. So this is how the observation room looks like in the image. So you have a lot of events, a lot of activity in recording audio and video data, right? So they are recording this and they're also monitoring the exam at the same time. So this is what you have signed for when you came to in the earlier part before the exam, and you're signing the form. This is what you are consenting to allow AMC to do. All right, so let's move on. The audio and video will be very helpful in case of a technical error. For example, this is the examiner. He's holding a handheld device where he can, put in the scores. Sometimes, technical error happens anytime without any, you cannot predict it. It can happen anytime without warning. So when that happens, AMC examiners can go back to the recording and look at that recording and score you at that time. So in other words, no performance is lost. Okay, they can always score a candidate. All right, guys, this is probably what you all have been waiting for, the time where the clinical examination actually happens. So I'm going to share with you in extreme detail of all the events that happen in the 3.5 hours. Okay, so let's move on. So the first thing I'm going to talk about is the audio notification or the bell sounds. Just keep in mind there are 3 sounds. Okay, I'm going to share with you. AMC also have stated the sound in their clinical exam specification document. As you can see, I highlighted over here. But let me give you a visual description of that. So if you look at this diagram, just follow my lead here. So see the way I'm pointing at. So at the beginning, in the first sound, when the first sound goes off, that is the beginning of your clinical exam. Okay, that is the sound number 1. It's one sound. Okay, if this icon represents only one sound. Once the reading time has started, and the moment it ends and the beginning of the assessment time starts, you will have a second sound. All right, let me try to tell that again. The first notification triggers the exam. That means the exam begins. The second notification tells you that you need to go into your station, and that is the beginning of your assessment time, and that is the second sound. Then this is the tricky part. This part is where the third/first sound, like it's like 2 sounds, but there's 2 indication for the third sound. So there's only 1 sound, but what it means is you're done with this exam station, and you are now going to move on to the second station, and that is going to be your the first notification of that second station. In other words, the end of one station is the beginning of your next station, and that is why I put it as the 3/1 or 3-1 sound. Okay, so this sound is your third notification for your previous station and the first notification of your next station, and that is only 1 sound. Right, so you have sound number 1, sound number 2, sound number 3, and sound number 3 is the third one for the first station and the first one for the second station. That's all it means. So don't get confused. Let me try to make it a bit more clearer for you. So from your second station onwards, the reading time is going to be less than 2 minutes. This is another heads up that I want to give you, because like I said just now, your next station reading time starts when the previous station ends. So let's go back into this diagram. Okay, look at the diagram here. Let's say you are in station number 1. The first bell has rang, you've done your reading time. The second bell has rang, you've gone into the station, and then you went through the assessment time. And towards the end of the first station, there'll be a third sound for that station, where in station number 1, in this example, you'll hear a third sound. That third sound, what it means is that you got to exit this station number 1 and move to station number 2. And when you reach station number 2, immediately you got to start reading. In another word, there is no a gap, no break. The ending of your first station is the starting of your second station, if that makes sense to you. All right. So just keep that in mind. In other words, obviously, when you end in your previous station, you're going to have at least a couple of seconds, right, to come out of this station and go to your next station, and try not to think of what happened, and then start reading the stamp from the monitor. So you can imagine that you're not going to have exactly 2 minutes. And that is why, when you practice the way how the exam happens, you're going to do a lot better. So my advice is, don't drop a pen. Okay, so don't drop a pen when you hear the third sound. Just tell thank you and exit the station as soon as you can. All right. And then go to your next station and start reading. So guys, I just want to put this diagram here just to give you a bit of a comparison for those of you who are still deciding whether you want to do the face-to-face or the online exam. So this is a very interesting thing that I want to share with you guys. So if you look at the face-to-face, the timeline, you have a reading time, and then it goes directly to the assessment time. When the third bell rings, it also means the first bell of your second station, the reading time. Okay. So in other words, you don't have an extra time. But in the online exam, you have an extra time. Okay, this is the time that happens before your reading time. So there's a lot of extra time for every station in the online exam. And that is one of the biggest reasons why the online exam is 8 hours in duration, because a lot of time is utilized in this extra time. So just keep that in mind. Some of you might find this a lot better because you can relax and sort of build yourself or build your confidence back in that few minutes and then go for your next station. So if this is more appealing to you, you might be able to consider this exam, the online version. So guys, let's move on to the reading time. So let me share with you all the events that is going to happen in the reading time. And I'm also going to give you some very valuable tips, my personal tips that will help you in your reading time. So let's begin. So guys, this is how the reading time looks like. When your first bell goes off, you will be in front of this monitor reading like how this gentleman is reading. Okay, so the reading time is 2 minutes, as you know. So AMC will have a stem and a task, sometimes an image. All right, so there'll be one clinical stem. If you can see over here, sometimes it's short like this, or sometimes it's very long. So you need to practice your role plays with short and long stems and try to perform as best as you can before your actual exam. The next thing is sometimes AMC has 3 tasks. Sometimes they have 4 tasks. So there's a range of 3 to 4 tasks. But don't worry right now. I'm just giving you the points. Later we go through an example. And the next thing is AMC will have some images, as you can see over here. They might have image. Sometimes they will give you some set of investigation results or some charts that you got to work on during your assessment. Okay, let me now move on to the stem and try to show you how a stem look like. So guys, this is an example of how the AMC clinical examination stem or the clinical stem looks like. So if you see here, you will have a stem like this. You have one long stem or short stem. You might be given an investigation like this, a CT scan report. And then you will have your task at the bottom here. All right. So this is exactly how a stem will look like. So let me zoom a lot more clearer, a lot more into this stem, and then we try to work out some tips that you can use. So the first thing, guys, I want you to remember, you always start with the task. The moment you see your stem, the clinical scenario, start directly at the bottom. Read your task first. The next thing that you do is you're going to simplify the task. You see like how I simplified it here? Explain the CT scan, causes of pain, investigation, and management. So when I have the task simplified for me, it's going to be so much more simpler now, because AMC loves to give tasks with long, windy sentences which are not necessary to keep in your mind. You just got to take the gist out of it, like this 4 highlighted point. So when you have simplified the task, and now you're going to begin with the STEM. All right. So as you read the STEM with the task at the back of your mind, you're going to read a lot better. Okay. Then you will be able to make sense of the clinical STEM. All right. So I want you to do that. The next thing I want to talk about is for you to practice as much sample questions as possible. Do this kind of questions that will give you, that experience on how you're going to tackle it during your actual exam. And just a heads up, guys, these questions are something that Doc Roach does. This is our sample questions. So we try to create questions which are very similar, high quality for your AMC clinical examination. So I'm not going to go detail about this STEM that we have just discussed. So if you're interested in knowing how to do a role play for that, you can check out this video on liver lesion, which I have performed the sample role play. You can have like a great role play example if you're just beginning and you're wondering how a good role play looks like. Be a Doc Roach member. You can get a lot of those kind of role plays and be very helpful for you for your exam preparation. So let's move on, guys. I want to give you a heads up over here. During your reading time, sometimes you will hear distracting noises. You look at this image. If you see the door over here, behind the door, sometimes you can hear some laughs or giggles from whoever is inside. Okay, so that can be quite distracting. I just want you to know that can happen. And if you're really trying to read the STEM and the task and make sense of it, sometimes you can get frustrated. So that is totally understandable, but you can't do anything about that. You can't knock the door or say, keep quiet or something. No, you can't do that. But what you can do is you can take deep breaths, breathe in, try to relax and stay calm and focus on the task, and then move on to the STEM like what we have discussed. Okay. And I'm very sure you will do very well. All right, guys, this is the next step. We're going to talk about every event that happened in the assessment time. Okay. So let's move on to that. So the assessment time, as you know, it's 8 minutes. So what will be given to you are pen, paper, and relevant items that you will be using during the exam station. So the next thing is, of course, you have an examiner with you throughout the entire exam station. All right, the examiner will always hold something on their hand, and usually that is the handheld device whereby they will score you and put your marks in that. And the next thing you may have is either a standardized patient actor, someone who has been trained to act as a patient, or you might get an actual patient, a patient who has a certain chronic illness or certain kind of illness that they can safely present themselves during an exam. And the third type of a thing that you'll be working with is a mannequin like a doll, like a dummy that you may need to perform certain things, certain examination on. So just keep in mind, these are the 4 things you will expect in an exam station for your AMC face-to-face exam. So let's move on. The first thing I want to give you here is another heads up of the timing. The time is yet again less than 8 minutes. So why that happens, why the assessment time is real time less than 8 minutes, is because the first few seconds, the examiner checks your ID tag. Okay, this examiner is going to ask him like, can I see your tag? Can I see your ID number? And then they will compare that with their handheld marking device. They will check and make sure the 2 things are same before they proceed with the station. That happens at the beginning. If you look at this diagram, if I were to zoom it for you, let me just show it here. If you look at this part of it, the blue thing here, every time before your assessment, just right at the beginning of the assessment, there's about few seconds, like maybe 10 to 20 seconds is gone, just for that part. So keep that in mind. The second thing during this time is the examiner will ask you some question and introduce you to the patient. For example, this is the question that the examiner will ask you. Do you understand your task? And then if you say yes, the examiner will say, this is Mike, you may start. Okay, so this is what happens at the beginning of your assessment time, all right? So I want to give you a valuable tip here. I want you to keep in mind that you need to stay relaxed during the beginning and don't rush the examiner. I mean, that's not a good first impression if you try to rush the examiner to begin your station. Okay, so don't worry too much about this few seconds. If you have practiced enough, you will manage to have a very good time management. All right, guys, at this point, I want to give you some good advice on the types of stations that you will encounter during your exam. So let's begin with the first one. The first one, I call it the diagnostic formulation station. So that stations usually have history, diagnosis, and differential diagnosis. So this is one of the types of stations that AMC gives you. Similarly, you will have a management station. In the management only station, sometimes AMC only wants you to explain the investigation results and tell the management. And this can happen in several forms. Sometimes you will have a phone consultation, and sometimes you need to do a medication prescription. So these are some possible scenarios that may happen in a management station. The other thing is, there are sometimes you will see something called, these are something that I call a full station, and that's why I put here in the apparentries, because a full station is something that has history, diagnosis, investigation, and management. The first thing in mind, why I try to classify my station is, if I know that is a full station, I will also keep in mind that my time is going to be very short. So what I need to do is be a lot more quicker in the way I do my performance. So that's why I try to classify it, in this category. So a full station means that I got to perform a little bit more faster. And the next station is counseling station. So counseling or education stations includes breaking bad news or de-escalation of angry patient, or, counseling any kind of topics, the common ones like, for example, risk assessment for CVS or cardiovascular examination on a patient. The other thing could be, counseling on, breaking a bad news for newly discovered cancer. So these are very common counseling stations that you will have. So you need to prepare to make sure that, you can do this very well. And in a counseling station, the moment you know it's a counseling station, what you really need to emphasize is your communication skill. Use simple English, skip as much as you can the medical jargons, and you will do really well for your counseling station. And the next one I'm going to talk about is the physical examination stations, or the MSE, right? Mental state examination. So this is another possible station. So in the mental state examination, one of the common ways AMC gives the candidate is a video, right, on a patient's presentation. So you got to watch that video and then do your mental state examination on that patient in that video. All right, and then you present it to the examiner. So let's move on. This is some general super good advice that I want you to do in all, let me repeat my sentence, in all your exam station. You got to do it everywhere. The reason is because I know AMC is very careful about this. AMC wants this in their candidates. So the first thing you got to do is a good introduction. A good introduction is something that is short and warm friendliness. It's like, introducing yourself while immediately building rapport. All right. And the next one is you call the patient by name. You don't call them, by any other thing apart from their name. So when the examiner introduces the patient to you, try to go and find a paper and write the name on that paper as the first thing that you will do, so that you can call them by their name. The next thing is you need to have a good eye contact. You got to always practice empathy and reassurance. This is extremely important. Extremely important. I can't emphasize that beyond this. It is something that you got to do in all your stations, including your physical examination station. All right. And the next thing is speak in simple English. If you do this well, you can communicate well with the patient. That's what AMC is looking for. They want the doctors who can really give very simple instructions or information to their patient. The next thing is try to limit medical jargon as much as possible, with the exception that sometimes when you inform the diagnosis, that diagnosis is going to be a jargon. You can't avoid that. Tell that, and then tell the equivalent simple English of that. Now guys, to be reminded of this rule, for all DocRoach members, we will have that reminder everywhere throughout our website, so that whenever you are performing your role play and when you are looking for the review of your performance, you will see that everywhere. You will always see that in your monitor, all these rules that I've talked about. We want you to know that all the time, and therefore for every role play questions, these rules will be there for you, so that you are going to be reminded every step of your journey. All right, guys. Now I'm going to talk about the another practice tip that I want you to have. Okay, so the moment you enter into an exam station, you can see here that you will have the STEM and the task on the screen. There is another monitor, a secondary monitor within the station, and that has the same STEM and task. Okay. On the other hand, you will also have the STEM and the task printed in a paper and then put on a table inside the station. So you have two places to look for your STEM and task. My tip here is for you to always have your task next or close to you, because when I perform my exam, I always want my task next to me, because the task is very, very important. The way you get awarded, the way you get scored is mainly through the way you complete the task. The more tasks, you got to complete all the tasks. If you do that well, that's how you're going to get your scores, right? So just keep your STEM and the task next to you. And the other tip that I want to give you at this point is when sometimes AMC gives suggested timing in the task. For example, look over here. Sometimes you might have a task that says, take further relevant history for 4 minutes. So my tip here is for you to stick to that timing. If it says 4 minutes, try your best to keep it within 4 minutes. But obviously, the biggest question here is that there is no time. There is no time measurement during your assessment time. So the way I know how a 4 minutes feel like is by doing countless number of role plays. I do as many role plays as possible to know what a 4 minute feels like. You might not nail the exact 4 minutes, but if you can get it around 3.5 minutes, close to maybe 4.5 minutes, it's close enough to know that this is long enough for 4 minutes. So when you keep practicing your role plays, you will know how a 4 minutes feel like, and then you got to try to stick to that. And sometimes if you exceed the time quite a lot, for example, now you are 5 minutes and you're still taking history, the examiner may interrupt you to tell you, candidate, please move on to the next task. So expect that if that happens, all right? And it's important you stick to the time, because if you don't, you're going to lose your other task. You're going to run out of time. So be careful of that. And my biggest advice, do not miss any task. If you do, then you're not going to get the marks. It's going to be very scary, if you think about it, if you did not complete your task. So practice your time management. Next, I'm going to talk a lot about the physical examination, and what I'm going to tell you about the physical examination is the tips and the tricks, like what you're going to expect. So the first thing is, when you have a physical examination, you can, like I said in the beginning here, you might have real patients, or you might have standardized patients, patient actors or actress, or you have a mannequin. You might have a mannequin like this. I'm not sure if you guys can see it, but let me try to zoom that in. So you can see this doctor is examining a mannequin, or a neonate or an infant mannequin. So you may need to perform examination on a mannequin. So keep that in mind. So let's move on to the next slide. So the tip here for the physical examination is, I want you to sanitize your hand before starting. All right, before starting a physical examination, sanitize your hand. However, if there is a COVID outbreak, AMC may want you to wear glove instead of sanitizing your hand. So just be aware of the current rules, okay? Because if they want you to wear a glove and you start looking for a sanitizer, you may not find a sanitizer, and all you can find is the glove box. So that's what you need to wear. The next thing is that a physical examination, you must always follow this mnemonic called WIPER. All right. So what is WIPER? WIPER, W stands for wash your hands or wear your glove. The other thing is your inspection. The P has a few components. All right. The first thing you got to do is check the patient's pain, inform the procedure. That's the second P. The third P is the permission. The fourth P is then the position. You position the patient. E is exposure, and R is standing on the right side of the patient. That is what WIPER stands for. And this is available in the textbook, Tally O'Connor, the clinical examination textbook. So you can use this. This is very helpful. It gives you a very clean and clear outline of what you got to do to make things efficient. So let's move on to the next slide. Here, I'm going to give you some tips. Sometimes you might find this kind of odd scenario whereby the patient is on the left side of the bed or incorrect positioning. So if you look at this diagram on the bottom here, let me try to zoom that in for you. If you look at this bed over here, if you imagine someone putting the head here and the leg here, he's going to be on the left of you. So when you walk in here, you're going to be on the left of the patient. You can imagine what I mean. If a person puts his head here, his left shoulder is going to face you. So you're going to have to examine him or talk to him while he's on your left. So sometimes you may encounter a situation like that. And this is the tip. If the patient is on the left side and that is uncorrectable, just like this scenario, you just proceed with the examination. Don't tell him to switch the position or don't try to, turn over the bed. That's not going to happen because why? You don't have enough time for that, and that's not what you need to do. Just proceed directly with the examination. And the other thing is, if the position is correctable, if you can correct the patient, then correct it as part of the WIPER. The second P is the explaining the procedure, and the third one is positioning. So you do that, and then you correct the position. Okay, you have to assess and see which one is more doable. Okay. All right, guys, let's continue still on the physical examination. So here, I want to point out to you that during the physical exam, the examiner may interrupt, okay, because due to time constraints. Sometimes, of course, we know that you can't finish entire physical examination in 8 minutes. So sometimes it's not possible, and the examiner may interrupt at that time. So when that happens, if the examiner interrupts you, don't take that negatively. That's the second point. And you may be asked to perform a part of the physical examination. Sometimes you need to verbally inform the examiner the remaining portion or the remainder of your examination. Because of time constraints, you may not be able to perform the remaining part of your exam. The examiner may ask you, like, what are you going to do next? And then you got to answer and try to complete your examination verbally. So be mindful of that and try to practice in your real exam as real role play practice as well. All right, this is some good heads up that I really sincerely want you to take back, because this will really guide you and help you and give you your confidence. So with the AMC examiner, the first thing is they provide no guidance or help or whatsoever during your clinical examination station. They will not help you. So keep that in mind. And when during the examination, the examiner usually stands beside you or behind you. They will stand quite close to you, not extremely close. They will stand like probably a meter away, and that is somewhere that you can't see them. Okay, they just want to make sure that they can hear you, and that's where they usually stand. So just keep that in mind. This is what the examiner will do. The other thing about the examiner, they have a very standardized robotic-like reply. So for example, if you ask the examiner, is there anything else that you want to know? If you ask that question to the examiner, this examiner, like a robot, is going to reply to you, is there anything else you want to ask or do? So this is your standard reply. Every time you ask them something, you're going to get this standardized robotic reply. All right? Robotic in the sense that it's a little bit emotionless, not much emotion in that. So let me give you the tips. I want you to treat all of this as a normal response. Everybody is treated the same way. Okay, so Don't take it personally, and refrain yourself from taking this as negative. This has nothing to do with your exam performance. Okay, so one good piece of advice here is always focus on your patient, not the examiner. All right, don't be upset because something happened with the examiner. Rather, try to place your focus on doing your best for the patient. And if you are successful in that, you will be successful in passing your AMC clinical examination. You know why I tell you that? Because I did that personally for my exam and I passed it on my first attempt. So you should try that, and I can guarantee you will pass it on your first attempt. So guys, another quick tip. During your examination station, if you are finished before the 8 minutes, okay, then my advice to you is exit the exam station. Exit the exam station to save the next station's reading time. Remember that your third sound, the third audio notification or the bell sound, is also the first sound for your next station. So because of that, I prefer waiting outside of your current station, so that as soon as the bell rings, the final bell rings, you can immediately walk to your next station. All right, so this is what you should do when you finish early. Don't wait in the room. That's no reason to wait unless you have something else you want to talk to the patient about or inform the examiner. All right, another very important tip on finishing early is that you can always return back to the station before the bell rings, okay, before your time is over. So it's also written in the exam specification down here. You may return to the station anytime. Okay, so if you suddenly be reminded of something, don't lose hope. Go back, knock the door, go back and say, sorry, I missed this, I forgot to tell you this, and quickly tell that, because you're most likely not, you're going to run out of time. So quickly tell the few points and then say thank you again and then walk out. All right. The other thing I want to tell you is, if you finish early because of what happened, you might just come out of the door and do this, stand facing away of the monitor. All right. So you remember what happens if you do this, right? This is what happens. This guy, the exam marshal, he or she pops out from nowhere and then corrects you. So try to keep that in mind. Try to always face the monitor. If you don't face the monitor, he's going to tell you to face the monitor. All right. So guys, that concludes the exam station. And now I'm going to move on to the rest station. I want to give you some valuable advice here that you can utilize, refresh yourself, build your confidence, and then move on to your next station with a higher energy level. Okay, and hopefully do better in your next station. So I'm going to talk about the tips in the rest station. So guys, we have looked into the rest station. The rest station is here, station number 3, 8, 13, and 18. The total amount of time you have per rest station is 10 minutes. Okay, it's made up of the 2 minutes reading time and the 8 minutes assessment time. So you will have all that in one set of time, which is 10 minutes. So that's a good amount of time to calm yourself down and try to get ready for your next exam station. So what happens is that during your rest station, can you see these people here on the orange chair? So they are sitting on that chair facing each other. So candidate on station number 3 will sit on this kind of orange looking chair and face candidate on station number 18, for example. So they're going to face each other. So just here, an awkward alert. You guys are going to be staring at each other. So it might be a little bit awkward, but this is normal. So don't be too carried away by that. On the other hand, there's other things you can do during your rest station. You can walk into the rest station. For example, from this chair, you walk into the station, and inside the station, you can find some drinking water. And I recommend you at least having a sip of water. The reason why you got to do that is because after talking for some time, your throat might be dry. So try your best to drink a little bit of sip of water. And if you feel like you need to go to the toilet, you want to use the toilet, you can call the exam marshal, carry up your hand, raise your hand, get the attention of the exam marshal, and they will help you with that. They will bring you to a toilet and you can use the toilet within your 10 minutes. So there are also something else you can do. Sometimes there are biscuits and sweets but let me give you a hint here. This is not always present. I have some of my friends who did not get anything at all. And one of my other friend who got a biscuit during his rest station. So there's a little bit of a variation here, but my key important point here is don't expect to receive something. Don't expect to have a biscuit or a sweet. I want you to eat something well before your exam starts. Before you come to the exam, make sure you eat something and make sure that is enough for 5 hours. Otherwise, towards the end of the exam, you're going to get, your performance is going to drop because of your hypoglycemia sort of symptoms. You can't remember, you're too tired. Your mind is wandering around. So don't get into that sort of situation, all right? So do your best, do as much as you possibly can for your exam and pass and move on with your career. So guys, I am going to talk about the end of the exam, all right? So remember, this is not the end, but it's only the end of your beginning. Passing the AMC clinical exam will start your, a very strong future for you. So you got to do your best for this. So let's talk about what happens at the end of your exam. So this is the first thing. There'll be a final audio notification at the last station. After the end of the last station, everybody's 20th station, there'll be a final audio notification. And then the exam marshals will guide all candidates out of the exam hall. That's the next event. And the next thing is that you're going to go back to your waiting room where the locker is. You're going to collect all your lockers, all your belonging in your locker. Collect all of that, return the tag to the exam marshal. Remember the tag that you had, you got to give that back. Yep, here, you got to return your tag and your locker key. And then the next thing is you're going to leave the exams center. And that concludes the face-to-face AMC clinical examination for you, my friend. All right, that's usually it's a very relieving period. And if you do very well, it's a lot more enjoyable. So buy this from me. Trust me, do your best. Okay, practice as much as you can. So I'm going to talk a little bit about your exam results. The exam results is available on the Friday, 4 p.m., usually Melbourne time, 3 weeks after your clinical examination. And this information here is from the AMC official website. Okay, they say it's 4 p.m. Friday, Melbourne time, 3 weeks following your clinical examination. And then you got to log in into your candidate portal. All right, just follow these 3 steps here and you can see your exam results. All right, guys. So this is the end of this tutorial video. Here, I want to wish all of you the best of luck. I sincerely want you guys to pass your exam. Do your best. Use all the guide in this tutorial video as an advantage. Okay, be ready every step of the way. And when you pass your exam, please let me know. Comment on the video below here. And all the best, guys.